So I've got a doozy for you, Dr. Hunter. My husband and I went to the parent-teacher conference last week, and she's 3, so we didn't expect it to be too in-depth. Well, the teacher is using words like sweet and smart and all of the things that you really want to hear as a parent. But then she pauses and she's like, we really need to talk about this one thing. And I'm sure that you've already seen this and know, but she masturbates. Which is like the most hysterical conversation to have in a parent-teacher conference. And I don't even think we had any idea what to say. But it's to the point where they've actually separated her at nap time because they can't get her to stop. And so then we have to tell her, like, yes, this is something we noticed right after we took her diapers off around age 2.5. We had read up on it at that time, of course. And really respecting this teacher because she was just like, I want to make sure we're aligned on how we're reacting and how you want us to react. And so our rules at home are your hands have to be clean, and this is something that you do in private. But clearly she's not just doing it in private because she's doing it at daycare at nap time. And so I guess my question is it normal? What are the things we should be telling her? Because we don't want to demonize masturbation, but at the same time, she can't just be doing this everywhere.
She's doing all the right things by not making this a big deal with her daughter, but at the same time, setting limits about where it is acceptable for her to masturbate. I had one friend whose daughter liked to rub herself on the edge of the slide in their outdoor play gym, and that wasn't an issue until they had a family barbecue, and then it got a little uncomfortable. What's more odd than this scenario with the 3-year-old at daycare is that even really young infants can masturbate, and sometimes parents even mistake it for a type of seizure. Like I said, it's not very common for me to have parents ask me about this, and I don't know if it's because the parents are embarrassed. So I asked my colleague, child neurologist Michael Zimbrick from UC San Diego, whether he sees this in his office.
Yes. Another thing that we see, just saw one last week, is this thing called infantile gratification syndrome, which is a really polite way of saying masturbation. It is, again, considered a normal child behavior. All the child knows is that it kind of feels good. And if they do it again, it still feels good. And if they do it again, it still feels good. And that's essentially all that they're thinking of. They don't have all of the same taboos in their head that we do as adults. But the usual appearance is something that involves leg crossing, something that involves movement of the pelvis or the lower back or the bottom. And it is often accompanied by these facial expressions or holding of the breath or even a bit of sounds of straining or grunting. It can be distracted. Parents can redirect the child's attention, maybe pick them up or move them, and it'll stop. The kid may go back to it because, again, it feels good. And when things feel good, you have, an incentive to keep doing it. But it is something that we see. We tend to know exactly what it is when we see it. We understand that it makes parents worry, but it's a bit odd. And I always preface my statements by saying, you're going to think this is weird. You're going to think I'm maybe a little bit nuts, but I've seen it many times before. This is called gratification syndrome, which is a polite way for saying masturbation. And just in case you were worried, these children do not grow up to be sexual deviants. They don't grow up to do weird things in public or be exhibitionists or anything like that. It's a thing that comes and goes, and kids grow up fine.
Masturbation or gratification syndrome can be a tough thing to talk about, but if your child is doing this at a young age, it gives you a really good opportunity to connect with them and open the door so they'll trust you to talk about sensitive topics in the future. If your child's doing this, you can just simply explain, I know it feels good, but it's a private thing. So you can only do that in your own room, or you can pick another place in the house. Anyway, the child in this question was also probably using masturbation as a way to soothe herself to fall asleep. So it would be a tough thing to take away from her because she kind of needs it. I recently had a really interesting case of a 7-year-old who came into the clinic. She came in twice because she had vaginal irritation. And of course, at first they thought maybe she had a urinary tract infection. And I ruled that out. But she continued to complain about having vaginal pain. And so I thought maybe she had just straightforward kid vaginitis, which we see a lot. It's just irritation in the vaginal area. And oftentimes it can just be from using a lot of bubble bath, something like that. So our treatment that we always recommend is just to take a nice bath, maybe with a little bit of baking soda in the water for soothing, and then pat the area dry and then cover the whole vaginal area with diaper cream. So she went home and she did this just like I said. And 2 weeks later, she came back and she still had the exact same problem. She was still complaining to her mom that it hurt when she peed. I went through my usual thing again. I ruled out a urinary tract infection. Then I started going down my laundry list of things that can cause vaginal irritation. So I said, are you taking bubble baths? No, she wasn't taking bubble baths. I said, are you wearing tight tights? Nope, that wasn't it either. Then I said, are you sitting around in a wet bathing suit a lot? And she said, no, I always change out of my bathing suit. But her mom chimed in and said, yeah, she goes in the hot tub every night. And then the 7-year-old perked up and said, yeah, I love to put my vagina on the bubbles part because it tickles. So I do that all the time. And so the mom and I just both stared at each other, daring each other not to laugh. And we finally got the solution. We knew why this girl was having vaginal irritation, and it was from masturbating in the hot tub.